With me today, you will see I have Dr. Akim Ali, who heads the WHO office in Suva, together with Dr. Alisha, who is the head of health protection. And I just wanted to demonstrate that, given what I'm going to announce, this is the caliber of people that we have had to pull together to try and get our responses right. Yesterday, we recorded 4 new cases of COVID in Fiji. 2 of these cases are in Nandi and 1 is in Lutaka, and 1 is in Makoi. 3 of the cases involved persons who attended the funeral that we have identified as a super spreader event, including a husband and a wife who circulated through the community. They were placed in quarantine on Friday, and the Ministry of Health is tracking their movements and contacts for 5 days before they went into quarantine. So this is in Nandi, Lotoka area. Now regarding the Makoi case, we are not certain of the source of her infection, but the Ministry of Health is currently very busy doing contact tracing to determine who she may have been in contact with before and after she was infected. She has been placed in quarantine, but prudence requires us to treat this case as a possible community transmission. So remember, I've explained before, we get very concerned if we find a case and we do not have information that allows us to track it to any of the current cases that we know of. So in this case, we don't have a source point, so we're deciding we shall now call it a community transmission. And as our investigation goes forward, we may find the source point, and this may or may not represent a new cluster. Got it? Potential cluster. Let's just leave it at that. So, because we cannot yet pin down the movements of these people and identify all their contacts, we are forced to take strict precautionary measures against the possibility that the virus has spread within the Lami, Suva, Nosori areas and within the Nandi Lotoka area. Once we receive further information regarding the Makoi case, there may be some variations to the measures that we are going to put in. We have experienced this situation before, so it would be familiar to everyone. Our purpose is to keep people from circulating unnecessarily. If people don't move, the virus can't move. Beginning at 4 a.m. Monday, when the curfew period ends, and for the next 14 days, the greater public will not be allowed in or out of the following containment zones: Lami, Suva, Nosori. So we are okay. We've already got Lotoka, and you got Nandi. So Lotoka and Nandi will be considered separate containment zones, and then we'll have separate containment zones for Lami, Suva, Nosori. For a period of 14 days, we will be closing off exits at the following checkpoints, starting from 4 a.m. tomorrow, the 26th of April. It begins from Wainandoi to Tamavoiwai, and that will be the Lami area that we'll rename. Then from Tamavoiwai to 8 Miles Bridge, which will be what we call the Suva Containment Zone, and 8 Miles Bridge to Longani Village on the Kings Road, which is what we're going to call the Nosori Containment Zone. Similarly, as I said, the Nandi Lotoka will be divided into 2 zones. We'll have Nandi Zone, beginning from Momi Junction to Lomolomo Police Post, and then from Lomolomo Police Post to Nadila will be your Lotoka zone. So, what we are saying is that currently there is free movement between Lotoka and Nandi. Now it won't be allowed. Between all those containment zones that I've mentioned, you won't be allowed to just pass through. Only persons traveling for medical purposes will be allowed through the checkpoints. All non-essential businesses must remain closed. Supermarket shops selling food and other items will remain open, so people can buy these essential items within their respective containment zones. Similar to other essential services, markets will remain open only in and for respective containment zones. Pharmacies will also remain open along the same vein. The point is, food and essential goods will remain on the shelves of our shops, markets and supermarkets. Please do not run up to the supermarkets and start bulk buying things this afternoon or this evening. Doing so will only crowd those stores and will put every shopper at risk. So what we're getting at is that we are going to allow some degree of movement during that lockdown phase, just so that you can access some of your essentials. It's not going to be like completely like a curfew. Curfew is still between 11 and 4. As I said, restaurants can remain open, but only for takeaway and delivery orders within and for the containment zone. There will be limited banking services available, as will FNPF and FRCS. Public transportation within the different zones will be available, but it has to be limited to 50% capacity. We have made arrangements through LTA for this to be practically implemented. Civil service employees will be authorized to work from home at the discretion of their respective permanent secretaries. Essential businesses will remain open as they did during our lockdown period last year. The list will include air and rescue services, air traffic control services, post services, civil aviation, telecommunication services, food and sanitary manufacturing plants, electricity services, emergency services, fire services, health and hospital services, lighthouse services, meteorological services, mine pumping, ventilation and winding, sanitary services, food and distribution of fuel and gas, power, telecommunications, garbage collection, transport services, water and sewage services, FNPF and FRCS, civil service, private security services, and roading services. So if your business is not in this list, close it down. The ports of Suva and Lautoka will remain open for international freight shipping and inter-island cargo shipping. Any inter-island passenger travel from the ports of Suva, Denarau, Vunda, Lautoka remains prohibited. We will implement the previous Agriculture Marketing Authority arrangements to get food and produce into respective containment zones. At all checkpoints, suppliers can arrange with police driver to ensure that produce still comes into respective containment zones and we don't let the virus escape the containment zone. Employers in the listed essential businesses need to arrange a permission document for their employees in order to pass through the checkpoints, as was the case during the previous lockdown. Employers should also try and make arrangements for their critical workers to move into the zones for the 14-day period. Please contact 158 to acquire the permission documents, which will be your passes. The Fiji Police Force will efficiently facilitate responses. For employees, if there is no branch of your company which you can report to in your containment zones, please contact your employer. For those who cannot work at home at all because of the setup of the containment zones, they will be able to access $220 a fortnight from the FNPF. If funds are insufficient, government will top up the accounts. Even within the respective containment zones, residents are again advised to avoid large social gatherings, particularly indoors. Stay home. Your interaction should be limited entirely to those already living in your households. If you're missing a friend or a loved one, do the safe thing and call them on the phone. If you need to walk around or exercise, you may do so, but wear masks, maintain social distance when you must be out. It is particularly important to download your Care Fiji app and keep your phone Bluetooth turned on. You need to wash your hands regularly. We were approaching the finish line, but we've had a setback. Now to get back on track, we all have to be together. We are taking these early measures again to prevent the spread of this virus throughout the country. We have done great work together to keep Fiji safe so far, and we have seen how opportunistic this virus is. One small innocent lapse or a careless attitude to our health measures by one person can start a chain of infection that can spread rapidly and sicken thousands. Fortunately, we have the knowledge, the infrastructure, the people, and the will to stop it. So I urge all Fijians to keep making this effort. Adhere to these health protocols. These protocols will be implemented and enforced by health and police officers. And all these protocols will also be gazetted today. I'm confident the vast majority of people watching know we cannot afford to lose the war against this virus. I know most Fijians are following and respecting the rules we put in place, but too many still aren't. So if you've been thinking that this virus isn't your problem, or that somehow your behavior hasn't needed to change to sort it out, please get a grip. You can see what's happening in India. You can see what's happening in other countries like Brazil. We cannot afford that, and we must not afford it. We must not even contemplate it. The virus is here. It is serious. Anyone, anywhere could be a carrier. If people follow the government's directive, we will lock this virus down and we will win this war. If people don't, many will die. It's just that simple. There's no other formula to follow. Report any symptoms you're feeling as soon as they develop by calling our COVID-19 call center on a toll-free number, 158. Stop sharing billows and takis. Stop shaking hands, touching and embracing. Wash your hands with soap and water for 20 seconds, multiple times a day. And we must take every day one day at a time. This is not a reason for despair, but an opportunity for us to contain. Our greatest hopes is in the hands of every Fijian. Please, for the fate of our country and those we love, do what we've been directed to do. Don't let this opportunity go to waste. Thank you. We will be taking questions at this point in time. I do have other expertise that I've called upon in case I may need some support with regards to some of the questions that have been asked. Thank you.
Thank you very much. Members of the media will now open to questions. Please raise your hand and also your name and organization you're from.
Josaya Nanunga from FBC News. I will direct this question to Dr. Fong. With the screening updates, how many have been screened so far for those who attended the funeral in Tawakombo Toka, and those who have been screened during the restricted movement period?
I did mention that we've received more than 500 swabs from Lotoka, and we have received way more than 600 swabs within the Suva area yesterday. That's yesterday alone. There's a lot more before that. If you recall, before that we had already started swabbing in that in the settlement where this lady stayed, Waini Taro. Yes, we had swabbed everybody in this settlements. Yeah? We don't have any positive results to report at this point in time, apart from the ones that I've just reported. You know that the cases in the West, they all related to the funeral, and they are all part of the group that we have been screening for. We knew that we got information as who they were, where they were, that the fact that we established that they did come out from the funeral. We started swabbing them. All three of them we did end up quarantining, but we are worried at the fact that it took a while for us to catch up with them, because the event happened on the 17th, 16th, 17th, and there's about 6 days delay before we were able to get them into quarantine.
Dr. Fong, Shanil here from Fiji Village. Like you mentioned that the case for the Makoi case, you don't have a source. So can you just talk about the contact tracing efforts and how difficult is it to contact trace the people she came into contact with?
Yes, I think to understand the magnitude of the issue, the Makoi one is something that we really are worried about. Because we know from her, we can find who she contacted. Our problem is working out how did she get it, and between the time she got it to the time she's been positive, who else may have, who else may have, how did that road come to her, okay? You can imagine that if she's the end of a long road, then there are a lot more people. If she's the end of a short road, then we got a lot less people to deal with. If that's the best way I can explain it. So it's just the fact that we don't know how many generations from the source point to her. That's the one that's concerning us, and we want a good lockdown. We actually want people to keep still, so that again we can start moving more rapidly and screen a lot more people quickly. And by doing that, you do two things. Number one, we'll get all the positive ones and contain them. But number two, even if we don't get the positive ones, those who are positive and are unknown, they will not be able to transmit to anybody.
Dr. Fong, how did you find out about the Makoi case?
Again, the Makoi lady, she felt ill and she presented to the screening clinic. And that's how we picked up, because as I said, our screening clinic, anybody with any upper respiratory tract infection is swabbed. That's it. That's if you are sick, you get swabbed immediately. Okay. There is in some instances they do have a history-taking part to it that allows you to risk assess as to who gets screened automatically and who doesn't. But in this case, we felt that she fit the criteria for screening, and she was done.
So she's been placed in isolation since?
Yes,
would
she
you know?
she is in isolation. She is in isolation.
Dr. Fong, just for the Makoi case again, can you just tell us where in Makoi, because Makoi is a large area, and what actions are you taking? Are you going house to house screenings?
Yes, Makoi is a large area. We are doing house-to-house screening, and at this point in time, in the interest of sorting out our containment plan, we would like to keep our information to that much. Right? Those people living in and around will realize the people who are coming in and who will come and advise them. Again, for the purpose of containment, we want everybody just to stand still. That's all we need, so that we can sweep through and remove any positives from within that area.
Dr. Fong, so where in Makoi exactly is she?
Exactly why I'm not saying it. I'm saying that's going to affect our containment plan. I will release that particular detail tomorrow, for sure. For today, I just need that information so that after you go away from here, tonight, we will sit down again, reset up this table, and have another long discussion about who's going to go where tonight.
Dr. Fong, has the ministry able to identify places maybe where this women had traveled during the past few days, or is it still in the process of trying to get this?
Again, we have identified it, and after we finish this meeting, we will move through all those areas and start setting up a response plan. You notice that the diagnosis actually was established this morning. We've already set up a group that are going through that area, doing the containment plan as we speak. I just want to give them more time to lock in the places that they need to work through before we start giving out more details about this case.
Dr. Fong, I wish to just to update the public on the health status of the soldier. the first confirmed case over the past weekend. And if the ministry and relevant authorities will institute a disciplinary action once he's being released from the isolation facility for the breach.
He is well at the moment. We do have a standing process that it's already legislated that anybody who breaches will be dealt with by the law, and the response or the legal response is already been well legislated.
Dr. Fong, now that we have a possibility of community transmission, has the Ministry of Health, if you're able to answer this, has the Ministry of Health able to identify the percentage of vulnerable groups, the elderly and those living with chronic illnesses that have been vaccinated in the past vaccine rollout?
Yes, that's a good question. I have not yet got that data, and it's part of our discussion this evening. One of the first things that we discussed this morning and was highlighted by our WHO consultant is that the vaccination must go on, and it is so much more important now than ever that we get our vaccination going. There's a lot of discussions around vaccination, and there's a lot of efforts now to bring in more vaccines, and that will be part of the overall response to this current outbreak. Yes.
We'll be open to 3 more questions.
During the next 14 days, what are the circumstances under which people are allowed to move around? And anyone found loitering unnecessarily, will they be arrested?
Yes, in this instance, this lockdown will be mandated. You've asked me a few times whether we can mandate this and mandate that. This one definitely mandate. This morning, and part of the reasons why I've had to take time to fix up my speech and what I can say is that to make sure that it aligns with people who are sitting in my office and writing up the Gazette, to make sure that we are not making any disparity between what I meant and what they gazetted. It's really important to us that we mandate and we have the power to actually enforce this lockdown.
Dr. Fong, the other 3 cases, did they test positive in quarantine, or were they?
They tested. Okay, the first one. Do you remember? The first one was negative, and then positive, and the other ones were brought into quarantine, and then they tested positive. However, when you track back the history, there was a period between the time they could have got infected to the time that they got into quarantine. And it's that 5 or so days that we have to backtrack and ensure that we lock down, we actually scan or screen out the areas that are of concern. Yeah? There are a number of small screening zones that needs to be set up according to their movement.
Dr. Fong, how confident are you on your containment areas, especially because there may be cases in Suva and Lami now, and there's no source for the Makoi women?
Yes. You see that if you look at our containment area for the, what we call the Lami, Suva, Nosori area, it's well beyond the boundaries and well beyond that of last year. This is a big boundary. The reason we want to have this containment to be as big as possible is that we need as more people as possible to keep still. That's the whole point. If you keep still, it doesn't mean that we will come and see you at every single house and knock at your door. Once you're keeping still, and then tonight we sit down and then we start pulling out the areas that we'll prioritize for screening. But it's not like we can finish every area in 2 days. It means we have to move from the high priority area, then we go to the less priority area and keep on going out until we can cover most of the area of interest. The containment zone might change too according to the history we get. If the history becomes more pointed, then we might have to decrease or we might even have to increase the containment zone. Okay, that's how that's a necessity moving forward.
Just to add, in answer to that question, Dr. Fong has mentioned also that We want you to keep still so we can do our contact tracing and the interventions in the community. The other reason is because if there are cases out there that we don't know about and we don't find, we know that when people move, the virus moves. So if everyone just keeps still for a period of time, we can actually stop the virus in its tracks, because you'll have it and you may pass it on to another person, but if that person keeps still, it won't move beyond them. It'll just die out. So that's another reason why it's very important that we just want everyone to stay within their zones, stay home as much as possible. And Dr. Fong has mentioned in his statement exactly the reasons why the reasons for why you can leave the house. And they're very small. It's related to medical issues, if you need to go out to get food. But please be sensible about it. If you need to go to the grocery store, don't take your whole family. Send one person, designate one person to go and do all of your grocery shopping, because we need you to keep still. We need you to stay home as much as possible.
Thank you very much, Dr. Lisha. We'll now give the mic to Dr. Kim to just address the media from WHO.
Thank you very much, and good evening, everyone from the media, and good evening to the community as well. It's indeed a very pivotal point for us in Fiji. We do have to be very vigilant and also very attentive to the directives that the government is giving us today. The key message about if people move, the virus moves, if it's with them, is an important one. So do please stop all non-essential movements. As a public health doctor, as a WHO representative, I will be supporting the Ministry of Health, leadership, and the technical team to mount a very suitable response. We've spent the whole of today, and we will continue to spend time to make sure that everything we do is in line with the best public health response that is possible to really mitigate and contain this virus. There is an important issue, which is this. Enforcement works to one level. Actually, what works best is when the community really, together with the government, with Ministry of Health officials, work with us to make sure that that very simple message, stop moving, is taken to heart and is followed.